Hello everyone, I am Dr. Sunil Patil. I am consultant urologist and andrologist at Athayo Urocare Center, Thane. Today I want to discuss an important subset of urology called female urology. Females in general have unique set of urological problems which are not seen in males and which needs a different diagnostic and treatment approach. One of the most common problem faced by females is recurrent urinary tract infection. Infections generally are usually very troublesome, but nowadays the infection has become very difficult to treat due to resistant bacterial profile. In general, females are more prone to infection as compared to males, but infection once a year or twice a year is considered to be normal. It can happen due to dehydration or due to unhygienic practices or unhygienic toilet, but more than that is usually a problem and needs a detailed evaluation. Recurrent UTI per se is defined as UTI infections or urinary tract infections of 2 or more episodes in 6 months or 3 or more episodes in a year. If this happens, it needs to be promptly evaluated why it is happening and needs to be treated adequately. There could be multiple causes for recurrent UTI, which includes problems in urinary tract, which includes stone disease, underactive bladder, or it could be due to poor hygiene as well as vaginal infections leading to vaginal discharge and bacterial overgrowth, which leads to urinary tract infections. Other common reason could be due to uncontrolled diabetes, and there are many other reasons which could be leading to recurrent UTI. UTI, if it happens, it needs to be promptly evaluated, the initial investigation of which is a urine culture test, which is very important in treatment because it guides further treatment which with antibiotic needs to be given, and it helps in clearing the bacteria completely. Most bacteria nowadays do not respond to first-line antimicrobials, and hence urine culture becomes very important for further treatment. It guides precise antibiotic therapy which helps in clearing the bacteria. After the bacteria is cleared, patient needs to be evaluated with ultrasonography, uroflowmetry and other appropriate tests as required, which helps in defining the etiology of the, as in etiology means the cause of the problem, and which helps in preventive strategies which can be applied to the patient so that it does not happen again. Another problem which happens in females, which is more common in older patients, what we call overactive bladder. In overactive bladder, patient experiences symptoms like urgency, as in whenever they have to pass urine, they cannot control it or they cannot defer it for a few seconds or even a minute also. Other problem is that urinary frequency. They have to go again and again during daytime also, during night time also. This is what we define as overactive bladder. This also needs to be evaluated and it needs to be differentiated from other problems like underactive bladder, urinary tract infections, and if other things are ruled out, overactive bladder has a very simple treatment protocol which includes medicines as well as pelvic floor muscle physiotherapy. This is important because overactive bladder usually affects the quality of life of the females, and quality of life, if it affects, it usually bothers the patient. If the quality of life is not affected, patients are usually not bothered, but affecting the quality of life, that is when the patient seeks treatment. And with appropriate simple treatment, patient can be very happy after the treatment, and which can be continued in a very simple way because it includes one tablet as well as pelvic floor muscle physiotherapy. Another important problem in females is due to weakening of the pelvic floor muscles, which can happen post delivery also, as well as due to an effect of aging also. This is what we call stress urinary incontinence. Stress means any stress which increases the abdominal pressure, which causes urine leakage. It is called stress urinary incontinence. This includes leakage during coughing, sneezing or lifting weights, which could be heavy weights, as well as normal weights which need to be lifted during day-to-day activity. This causes leakage of urine which is usually involuntary. Patient may know about it or they may not know about it if it is in a very small quantity. The severity of such disease may vary from mild to severe, where mild includes only a few drops of urine leakage and severe includes so much leakage that the whole of the undergarments get wet. The treatment of such problems is very easy, which includes pelvic floor muscle physiotherapy exercises as well as some medications which help in relieving the problem in a few months' time. Majority of the patients experience good relief with physiotherapy exercises as well as medications. Few patients who may not experience complete relief may need some minor surgical intervention, which also is very easy to perform. We at Athayu Urocare Center have facilities and experience to diagnose and treat such patients having female urological problems. Thank you.